Hi, my name is Annie Gibbons and I'm the CEO of Glaucoma Australia. I'm speaking to you today to inform you about our new Patient Referral Pathway. When you refer a patient to Glaucoma Australia, it's important that you know what we do, how we do it, why we do it, and when we do it. And we've taken that feedback from optometry very seriously, and we've designed a new referral pathway that has 4 stages. The stages are stage 1, preliminary diagnosis, stage 2, diagnosis confirmation and treatment, stage 3, adherence, and stage 4 is living with glaucoma. When patients are referred to us, they get sorted, if you like, into one of those 4 stages, or they progress, hopefully, via early intervention from stages 1 to stage 4. This is important because it allows us to strategically triage their patient journey through those stages to make sure that every patient query is answered, the patient feels supported, educated, and ideally less anxious as they progress through their glaucoma journey. The 2 most popular ways of referring patients to Glaucoma Australia are via Oculo or joining our community via the website. Practitioners using Oculo have the opportunity to refer their patients for free education and support to Glaucoma Australia when referring to the ophthalmologist at the point of consultation. So I'll now go through the stages in detail with you. Patients with a preliminary diagnosis of glaucoma and a referral to an ophthalmologist enter stage 1. The focus of stage 1 is the importance of appointment adherence. The patient will receive a welcome email from Glaucoma Australia and a personalised phone call or additional email support from the orthoptist educator who will reiterate the importance of attending the initial ophthalmic appointment. The patient is provided a handout to help them prepare for their appointment, and if the patient is not intending to make that appointment, they are strongly encouraged to do so by the orthoptist educator. Stage 2 is triggered following the patient's first ophthalmology appointment. The educator asks the patient if their diagnosis was confirmed, and if so, what type of glaucoma they have and what is their treatment regime. They may also ascertain if the patient is remaining a suspect or if the diagnosis was not confirmed. Education and support is then provided to the patient around their specific treatment regime. For example, information on eye drop application, technique and storage, or possibly information about laser. The patient is then provided the opportunity to ask the educator as many questions as required about glaucoma and their treatment. The educator also reminds them that the glaucoma is hereditary and asks them to tell their families to also get tested by an optometrist. Patients are encouraged to return to their eye health professional if they have any concerns or questions about their new treatment regime. The focus of stage 3 is treatment adherence and promotion of the family link message. It is triggered around 5 months into the patient's glaucoma journey. Research shows us that there is a 50% adherence rate of eye drops over the first 12 months. And so this intervention is strategic as it is timed when the patient's mindset goes from having an acute to a chronic illness. The educator provides a comfortable environment to discuss reasons of non-adherence and works with the patient so that they understand that every drop saves sight. They spend generous time answering all of the patient's questions around their diagnosis and treatment, and also explain that regular automated field tests and OCT scans are important if they are recommended by their specialists. We strongly encourage the patient to ask their family to make an appointment with their optometrist to get their eyes tested, as their risk increases tenfold. While Glaucoma Australia's strategic intervention is strongly focused on stages 1 to 3 addressing early intervention and treatment adherence, we continue to provide free education and support for people living with glaucoma. Building on 30 years' experience helping and supporting people with glaucoma, our educators are well equipped to answer frequently asked questions about diet, lifestyle, treatment adherence, and living with glaucoma. National data is now being collected on every patient receiving education and support via the patient support journey. This will position Glaucoma Australia as a national hub for data which will be used for future research to improve the quality of life for people with glaucoma. As part of our digital strategy, Glaucoma Australia have developed an automated communication pathway that will complement the education and support provided by the orthoptist educators. All patients will receive personalised emails with the attached support resource information tailored to the stage they are at in their glaucoma journey. As glaucoma awareness increases and more people get tested early and detected via the increase in OCT, Glaucoma Australia has a scalable model that all patients will receive email communications and priority phone call intervention will be given to those who need more emotional support or for those who are more aged without internet access. Bite-sized information will be continually produced by our clinical committees and orthoptist educators to support the patient journey, primarily in the area of video and patient handouts. Glaucoma Australia see themselves as a key part of the collaborative care pathway between optometry and ophthalmology. We therefore strongly encourage you to refer your patients to us at the earliest convenience, ideally stage 1, but at stage 2, 3, 4, every patient is welcomed and every patient is strategically placed in the patient support journey. When your patient is referred to us, you are saving time and therefore money. You are confident that Glaucoma Australia is clearly communicating the messages that would be time consuming in your practice. We are driving their family members back to optometry, and this is a key way of encouraging more and more early detection, which ultimately will eliminate glaucoma blindness.